appearing, maybe they'll be told to say, since you haven't been vaccinated, you can't attend to patients, you can't work. Maybe they'll be sent home. Is that not the route that we are likely to take?
No. We are not going to take that route. We are not going to discriminate access to provision of service based on vaccination status. Here, really, we are more concerned about an individual out there. We are concerned about the healthcare workers. We have had so many healthcare workers who have been infected with COVID. We have had a number of healthcare workers that have died from COVID. I personally have experienced seeing my fellow workers dying in front of me. And this is a picture which we would like to reverse. Would like every healthcare worker to be confident enough that at least they have something to protect them from getting severe disease so that they are not hospitalized and they can continue serving the Zambian population. We are not going to say if someone is not vaccinated, they are not going to attend to patients. However, we believe that our healthcare workers, they understand the great danger which COVID poses on their lives and also the general health of the Zambian population. And we believe that with the information which is available and the continuous engagement and counseling, many healthcare workers and other individuals will come up and get vaccinated.
We have so far received the doses or the vaccine, and one may ask, how many vaccines or doses are required for one to be vaccinated, or how many doses will be given per patient? Is it just one, or maybe others will be given 2 or 3?
Again, Kelvin, excellent question. It borders also on how we're going to implement this vaccine strategy. So far, there's only one vaccine globally which you can give as a single shot. The rest of the vaccines, they have to be given as 2 doses, including the vaccine which you have received, the Oxford AstraZeneca vaccine, has to be given as 2 doses. So what we have is, as you rightly said, covering the 228,000 doses, meaning those are the ones who are eligible. We are hoping that before the next shot, we should receive another batch as well, so that those that are vaccinated, they need to come for the second shot. And the importance of emphasizing this question and responding to it accurately comes to the fact that you need to have these 2 doses for one to have the protective effect which we want to get the benefit from the vaccine. And we need to assure individuals, the public out there, that they need to come back for a second vaccine so that they are fully protected. Not just one vaccine and we have a sense of belief that we are fully vaccinated. So far, the research which has been done among the 12 vaccines which are available shows that you need 2 doses, except the Johnson & Johnson, which has proven that you need 1 dose.
So with this one, Prof, one is required to receive 2 doses?
Yes.
And with the ones that we have, those that are eligible, starting tomorrow, will be receiving 2 doses?
They'll receive 1 dose, then they'll come back after 2 to 4 weeks, they'll come back for the second dose. For
the second dose?
Yes.
And this is not enough?
It's not enough. You mean it's not to protect them? The 2 doses are enough to protect one individual.
So in an event that we acquire Johnson's and Johnson's, these people that will receive AstraZeneca, 2 doses, there is no need for them to come back and say now that Zambia has acquired the Johnson.
No, there's no need. So these that are going to get the Oxford AstraZeneca, they will be on the Oxford AstraZeneca, finish the 2 doses. If we get the J&J, when we get the J&J, then those who will be vaccinated on the J&J will get 1 single shot. So there will be no crossover from someone who may have gotten the first dose of the Oxford AstraZeneca. Once the J&J comes on, then they move to go and get the J&J. No.
So now, listening to you, Prof, we have the Oxford, and in an event that we acquire the J&J, people might be thinking that, okay, with this one, you need 2 doses. With the J&J, it is 1 dose. So I'm not going to get the 2 doses. I'll wait for the J&J. Is it possible? Is it okay for people to choose and say, I won't get the 2, I'll just get the 1, or I'll get the 2 because I don't want to get the 1?
Yeah, remember, this is on a voluntary basis. So right now, if let's say, Kelvin, you decide that I'm going to get vaccinated tomorrow or next week with the Oxford AstraZeneca, it means you've said, you've committed yourself, you want to get this Oxford AstraZeneca, and you get the 2 doses. If you say, no, I would rather wait for the J&J, then you're not going to get these 2 doses. You wait for the single dose of the J&J. But we are hoping that individuals, especially those in the first tier, the healthcare workers, they can rush now and get this J&J, because what we are, the Oxford AstraZeneca, which is available right now, what we are looking at is, let's move in a faster way to vaccinate the key populations. And once we get those key populations, the issues of which vaccine is available should not arise. In terms of the efficacy, we are assured that the vaccines which we have looked at should be able to protect the Zambian people.
You've talked about the faster way. In an event that people don't show up, because it is on voluntary basis, in an event that people don't show up, let's talk about the lifespan. Or how long should we keep on waiting for people to avail themselves or to voluntarily come and get this vaccine? Do we have the capacity? Or first of all, let me ask this question.
Of storage.
Of storage. What is the lifespan?
So what we have,
the vaccine that we've received?
What we have, I need to confirm the expiry for what we have. We had received before indication of receiving something which was expiring in April. We did not get that. Okay. I need to confirm the batch which we have, the expiry. But we are confident with the expiry dates which are there, which are sufficient enough for us to vaccinate the population before the expiry. So we are not worried about the expiries, because the batch which we have received are batches which have enough expiry periods. I would just need to confirm with you when the expiry for this batch is, but it's way, way, way over 6 months, and it should be able to protect us adequately, and we should have confidence in the vaccine which we have acquired. Coming to the other question where you're trying to say, should we have capacity? If people do not present, do we have the storage capacity? Yes, we have the storage capacity. But I doubt that we are going to reach a level where we are going to have people not turning around to have the vaccines. We are looking at other countries. Look at our neighbors, Malawi. They vaccinated more than 200,000 people. They're using the Oxford AstraZeneca. And we believe that our people are also going to respond appropriately. And we are going to continue engaging through the media and also through other avenues, the individuals out there, for them to be available for vaccination.
You've talked about this one, maybe having a lifespan of up to 6 months or above. Let's talk about the vaccine itself. When one is vaccinated, how long does it stay in the body?
So far, we know that the protective effect for the vaccine is supposed to last up to 2 years. Now, there is still, again, more research going on around boosters, so that should the effectivity of this vaccine go down, you can give a boost. So far, we know that for sure we are going to have protection for up to 2 years, and more data can come out on how long someone is going to be protected. So that's how long the protection. And by the way, it's not the vaccine staying in the body. It is the vaccine inducing the body to produce antibodies. Those antibodies will still be sufficient enough should someone get the COVID. They will recognize the COVID, and they will prevent the COVID from attaching to the key body organs which would cause the severe disease. So it's the antibodies which will linger on for a long time, for more than 2 years. But the vaccine itself, it doesn't stay there for longer than for longer than 72 hours. The vaccine will just be there to induce the immunity.
You've talked about 2 years, and in an event that COVID stays with us for more than five years to come, does it mean after 2 years, people will have to be revaccinated again? Or what happens there? So,
Kelvin, there is a possibility that this virus may be dealing with may become like the influenza. I know here in Zambia, we don't routinely vaccinate people against influenza. In other countries, especially the Western world, you have a new strain of the influenza virus which comes almost every season, and people have to be vaccinated every year against this virus, the influenza virus. If you're working in a hospital, you're a healthcare worker, sometimes you'll be prevented from seeing a patient if you don't have that vaccine for this influenza virus. Now, here we're dealing with viruses, so there is a possibility, we don't know much about this COVID virus. There's a possibility that we may have to be vaccinating every 2 years or every year, depending on the strain which comes on. And I think the public needs to be aware that there's so much which is coming on, and there may be a lot of adjustment to how we fight the COVID, depending on the data and over time how we look at this virus. For now, we have this vaccine available. For now, we need to get the people vaccinated. And for now, we need to assure them that there is enough evidence to show there is protection, and this protection may wane after a certain period of time, and we may need to be giving the boosters.
This is the special interview on your channel of choice, Muvi Television, Tuesday, 13th of April in the year 2021. My guest on the program is Professor Lloyd Mulenga. We are discussing, is Zambia ready for COVID vaccination? We are told that starting tomorrow, people start receiving the vaccine. And there are categories of people that are eligible, and it will be done on a voluntary basis. Prof, let's talk about the category of people that are eligible to receive on a voluntary basis. We are told that above 18 are pregnant women also eligible to receive this vaccination?
Again, another excellent question. Pregnant women are not eligible, they say, to receive this vaccine. And let me elaborate this further.
Please.
The studies which have been done across all the 13 vaccines which we have currently globally have not included the pregnant population. They have been centered around those above 18 years and not the children and not the pregnant and breastfeeding. Now, because of that, we are aware that there may be certain side effects which may be induced against the child who is unborn, the baby who is unborn. There may be certain side effects which may be exaggerated because of the pregnancy state, certainly even for children as well. And we may also not see the same efficacy in the pregnant population, and that's why we call them special populations. So because the studies did not provide to answer questions if these vaccines are safe enough and protective enough in the pregnant population and the children, we are not recommending that the pregnant breastfeeding women get this vaccine. However, there were some who did not know that they were pregnant, and some may have known that they were pregnant and they got these vaccines. Then they went on to deliver as well during the trials. That subset of analysis has shown that there hasn't been any difference in the response in terms of the effectivity and also the side effect. But again, we are talking of people who were vaccinated while pregnant, and the question was not to answer if they would be protected when pregnant. The question was to answer for the general population. But that sub-analysis is assuring. Does it make us, of course, recommend that the pregnant women can be vaccinated? No, because the studies were not designed to answer that for the pregnant women. However, if a pregnant woman feels that the risk of getting COVID is higher and they would like to be vaccinated, yes, they can voluntarily come and be vaccinated as long as they know that we don't have enough data to assure them of the safety and efficacy in that population.
Is it not going to create confusion? It is not recommended for them. However, you say if they feel like. Are we not going to have cases of pregnant as well as breastfeeding mothers voluntarily presenting themselves to be vaccinated and then health workers advising them to say, no, 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 for you it can't. While in other areas or instances, other pregnant and breastfeeding mothers who have or who meet with these health personnel who say, since you've come voluntarily, here you go, or here you are, you'll be vaccinated. Are we not going to have an imbalance where others are turned away or are denied whilst others are given?
Not really. In the trainings that we are doing, and will continue doing throughout the vaccination process, we're emphasizing the aspect of what does it mean someone to present voluntarily. And we also have a checklist where we are checking a number of factors when someone presents for vaccination. So if someone is pregnant, they would be asked and they will be educated on what we know so far. Then that individual, even when they have presented, they will make even a decision there and then to say, okay, I can opt out or I can opt in. So we hope that those cases where someone is not given this information will be rare, so that we can at least save our people with the information which we have. And someone makes a decision on whether to be vaccinated based on the information which is available.
Ever since the vaccine breakthrough, there has been some conspiracy theories around the vaccine world over. Don't you think this decision by government raises even more suspicion about the vaccination process, where you keep on emphasizing that it will be on a voluntary basis? Don't you think it answers to those conspiracy theories?
Not really, not at all. In fact, the whole healthcare system, the way it's designed, you're not supposed to force an intervention on someone who comes seeking healthcare services. I'm sure you've seen several times when, if I'm a doctor attending to someone whom I suspect to have meningitis, I would recommend that they have a lumbar puncture done. If I had a way of forcing that, I would say let me force it through, because I know the benefit of doing a lumbar puncture in someone who is suspected to have meningitis. But we realize that there are certain people who have misgivings towards the lumbar puncture, and as a result, you give that option to a patient. If the patient refuses or the relative refuses, you don't go ahead. Of course, there are minor risks associated with doing such procedures. This applies to this same principle as well. We cannot force someone to receive something which is beneficial for their health, but in this case, it's even more beneficial for the larger population, for the larger country. Even when it's as good as this, it would be very, I would say it would be very unfair for the health system to force such an intervention on an individual. Remember, we have rights to choose. And globally, this is the same thing which is happening. I haven't heard of a country which is forcing vaccines on every individual.
Prof, there have also been reports of blood clots and other side effects in some selected parts of the world, and we have seen countries suspending because there are those reports of blood clots. How sure are you when it comes to the efficacy of the vaccine that we've received so far?
Kelvin, you raise something which is concerning. You raise something which we take seriously as healthcare workers. I've been treating COVID-infected patients from the first patient who arrived on 18th March. I have seen various complications of COVID. Just yesterday, I was in Mans attending to someone whom today we lost. And last week, I had a number of patients here who had blood clots as well because of COVID. Some we've managed to save them, others we have not managed. And we take seriously the issues that do really lead to loss of life because of an intervention. So yes, there are a number of vaccines. Right now we're talking of 2 vaccines that are being implicated with blood clots. The Johnson & Johnson today, the FDA has announced that implication. Then also we have the Oxford AstraZeneca, which over months now has been associated with that. Now, let me emphasize that, when you look at those, we're talking of a very, very rare event. And let me also just take this opportunity to say that the issues of blood clots, the issues of the platelets, which is the certain blood cells which prevent against clotting, which has also been seen with the Oxford AstraZeneca vaccine, is something which has been reported before for vaccines. And the model which this vaccine is being used, this is a vaccine which is given into another modified virus, an adenovirus, and that has also been reported previously to induce the low platelets, but very, very low levels. Right now we are talking of, if you vaccinate, we have vaccinated more than 20 million people, you have 44 events. Now these events are less than the blood clots which we get if someone gets those are women who are on contraceptives. So we're talking of a very, very rare event. Now when you look at the possibility of getting this clot, and also the possibility of dying from COVID, if you get infected, the chance of dying from COVID is much higher than the chance of getting this clot. So when you look at these two aspects, then you can safely say it's better with such a lower risk to go on with the policy of vaccinating the individuals out there. But again, we are mindful that this implication may be real. It has not been reported, of course, outside in Africa. We haven't reported it. The US, they have reported the 6 cases, but not related to the Oxford AstraZeneca. In Europe, these cases have been reported. In Asia, no reports yet. So we are really also going to use the people that we are going to vaccinate, follow them up actively, and we'll also be educating the individuals on how this clot may present. What are the symptoms for them to be aware that maybe they may have had a clot? And we're also putting in mechanisms of how to respond to any individual whom we suspect to have had a severe event.
Prof, if I heard you correctly, you've mentioned that there are 2 vaccines at the moment that have been reported, or there are reports of blood clots, and you've singled out that 2 vaccines at the moment have been pointed out, J&J and Oxford AstraZeneca. Isn't it?
Yes, please.
I want to understand, the vaccine that we have in this country is Oxford AstraZeneca.
Yes, please.
Which has that report. Mm-hmm. Are we safe?
We are.
What is it that you are telling Zambians? If it is one of those vaccines to have been, for lack of better term, found wanting,
okay,
and this is the same vaccine that we've received as a nation and ready to be administered starting tomorrow.
Yes. What I'm saying is, the information which is there, no causal link, no link. You cannot certainly, as we stand here, say the Oxford AstraZeneca is the one which is causing these blood clots. And as I've said, there have been reports before of other vaccines which use the same model as the Oxford AstraZeneca, which has caused the low platelets. Mm. And here what we need to look at in anything, look at when we are treating the people, even the same people with COVID, there's one key drug which we give them called heparin to remove those blood clots. The major side effect is bleeding. What we look at what is the benefit of giving this drug as opposed to the risk, in this case, the side effect. Similar thing, if you give paracetamol, the same paracetamol which you give individuals, it can also give nausea, vomiting, but we do not overplay and we say we are not giving paracetamol because it can cause nausea. Mm. We don't say that we are not going to give erythromycin because it can cause the mild pains. We see what is it going to prevent. In this case, if I give an antibiotic, it's going to prevent someone from dying. And of course, they may have some side effects. Some side effects may be fatal. Some side effects may lead to death. But you have to look at what is the magnitude of those side effects. And in this, we are talking of a very, very rare event. So this very, very rare event cannot really lead us to not use this vaccine to protect massive and millions of individuals.
Are there expected side effects? And if there are side effects that people are likely to experience, for how long will these side effects be with the people?
So, the major side effects which we expect from people will be from the injection site. They have pain. Sometimes you can have redness as well. You know, where you're injected, you have redness. You can have also itchiness as well. Some people may develop headache, some nausea, vomiting, very rare. These side effects are supposed to go out within a week, and they're mild side effects. The one which is fatal is this same event, if it's associated with the vaccine, the same blood clot. That's where some people, again, a percentage of those that may develop the side effects of the blood clot are the ones that may lead even to death. So we are talking of a very, very rare side effect. The main side effects are side effects which are manageable and which you see with many vaccines.
We've talked about a group of people, the breastfeeders as well as pregnant women. Let's talk about the people with underlying conditions. We have been told in this country that with those with underlying conditions, for them with COVID, and we've heard reports of COVID-associated, COVID-related deaths as well as COVID deaths. Let's talk about those with underlying conditions. Are they also eligible, or there are those with underlying conditions that are going to present themselves voluntarily and health workers will go ahead and administer, or with those with underlying conditions, even if they are to present themselves, they are not among the people that are to receive this vaccine?
So those with underlying conditions are one of, again, another priority population. And let me just elaborate on these underlying conditions which we are concerned about. We've seen that the majority of the people that we have lost in this country are people that get COVID and they have diabetes. So diabetics are a major risk category group. We also have seen those who have high blood pressure. So those with hypertension, also we have seen that the risk of dying is higher in that group. And we have also seen that others who present with severe disease and also die are the elderly, above 65. And again, those are another category which we consider. So the reasoning for the tiers is we have looked, first of all, the healthcare workers. The healthcare workers, we know they are at risk of getting COVID because of the high exposure. And they can transmit this COVID to these other risk categories and to the general population. That's the main reason. These others with comorbidities, it's because if they get COVID, the chance of them dying is higher. And that's why we need them to be vaccinated so that we can prevent them from having the severe disease. Others like HIV, TB, people who have any chronic lung conditions, people who have any other conditions, cancers, they are eligible for vaccination. It's not a contraindication. We're not going to say you won't be vaccinated because you have HIV or because you have TB or because you have a cancer. They are eligible for vaccination.
My guest on this special interview is Professor Lloyd Mulenga, responding to some concerns and questions that Zambians out there have when it comes to the issue of vaccination. Starting tomorrow, Zambians are those that are eligible and are ready to volunteer themselves to receive the dose. The exercise will start tomorrow. The number, in case you have a question or a concern and you want a professor to respond to your question or concern, the number is 0764-250055. The number again is 0764-250055. You can call that number, and the professor or Professor Lloyd Mulenga will be able to respond to your questions. Professor, as we are waiting for people to call in and be able to ask you a question direct, let's talk about the people that will start receiving the vaccine tomorrow. After receiving, is there a need to continue washing hands, to continue masking up, and to continue observing physical distance? Or we are going to see people saying, since I've received my own There is no need to wear a mask. There is no need to observe physical distance. There is no need to to wash my hands. How is it going to be?
That is important, and unfortunately, we have to continue with the same measures which have been emphasized.
Even after receiving the vaccine?
Even after receiving the vaccine. And again, your question, Kelvin, is very important and very cardinal for people to understand. Someone who is vaccinated is the individual. Right now, when you're talking of the smaller numbers to be vaccinated, is the individual who is protected from severe disease, from death. They can get the infection and they can transmit. So still, we need them not to get that infection. However, they are protected from being hospitalized. So that's the whole principle. So we still need to have these masks on. We still need to have the hand hygiene as well. The protection is to that individual. And the protection is not for them to transmit. They can get the virus and they can transmit.
0764250055 is the number. So even if those of us that will be that will be visiting these, health facilities to be vaccinated, even after receiving that vaccine, you still have to mask up. Hello, good evening. Your name, sir, and where are you calling us from? From Kawambwa. I have Professor Lloyd Mulenga with me. Please go ahead if you have got a question for Professor. Thank you so much, Prof. Let me just pick 3 more calls. You can just jot down the questions or the concerns that are coming from the people out there. Let me pick my second caller. Hello, good evening. Hello? Hello, good evening.
Hello.
Good evening, sir.
Hello, good evening.
You are through to this special program. Tell us your name and where you're calling us from.
My name is Clement from Western Province.
Clement from Western Province. I have Professor Mulenga. Do you have a question for him?
Yes, I just wanted to find out the safety of this vaccine. Because I was told these are going to undergo a certain scrutiny by ZAMBIA, of which I'm sure that must have been done. Now, there is a question mark. I don't know if we had other agencies, because ZAMBIA
Thank you so much, Clement. Maybe, Prof, I give you a chance to respond to Clement and the first call.
Thank you. My brother from Kawambwa is concerned, especially over the side effects that do come with the vaccine, thinking that those side effects may even be worse off than the infection itself. I need to assure Zambians out there that these vaccines, so far, we are not talking of them going to leading to death. Whereas COVID, we have seen close to 2,000 people who have died from COVID just in this country. And we have seen more than 90,000 individuals infected with COVID. And some of them, right now, they are struggling with long-term symptoms of COVID, some 9 months after recovery from COVID, which these vaccines are not going to do. So the side effects which are there are mild side effects, the common side effects which we expect to have these. These rare events, which so far in Africa where the vaccination combined on Oxford AstraZeneca itself, we're close to more than 500,000 in Africa. And we haven't reported these rare events of the blood clots and also the death associated with this, with the Oxford AstraZeneca. So we cannot say that because of these reports outside, we shouldn't give the side effects are very minor, the common side effects, and they do not cause death, these common side effects, whereas COVID does cause death. My brother is concerned over the safety again of these vaccines and the trust the Zambian people, I think the lack of trust in the regulatory agencies. Again, these vaccines which we have received are not just vaccines which ZAMBIA has looked at. They are vaccines which every other country is also receiving. We are not talking, I cannot talk on what may have happened with the other commodities at ZAMBIA. I'm not privy to that information. But I can assure the Zambian people that the vaccines which we have received are genuine vaccines. And they are the vaccines which the world over are also, the globe is also, those that are on AstraZeneca, the same vaccines which they are taking. So really the assurance is that these two vaccines are either from UK or from India. The Covishield which I've received is from the Serum Institute in India, and we are sure of the safety of these vaccines.
Prof, several businessmen and women that travel outside the country are required to have a COVID-19 negative certificate at every time they wish to cross the borders. Will there be some form of certificate given to those that will that will receive the vaccine, that since you've received the vaccine, here's a certificate to show that you've received, or what is it that's going to happen?
Yes, so we are going to certify on the card. We are going to be giving cards to show that someone has been vaccinated and which vaccine they've received, how many doses that they have received, and if they have received one, when are they coming for the next dose. And this card can be used also outside because there will be a batch number indicating which vaccine, which batch they received. There are certain countries we know where very soon it will be mandatory before you visit that country, you need to have a vaccine record. And Zambia again is joining the other countries which will be able to provide such. There are even issues of talking of the COVID vaccine passports as well, and also trying to make it easier electronically if someone is vaccinated, everyone else where they are traveling or wherever they are traveling to, they know. So yes, we are going to give certificates or cards to indicate that someone has been vaccinated.
In an event that one who has received the dose or who has been vaccinated dies, are there chances that government will compensate such a family?
I pray that no one dies from the COVID vaccine. What we need to put in place right now, and which we have put in place, is active pharmacovigilance. If someone gets the vaccine, we'll be able to follow them up and we'll be able to evaluate them. If, unfortunately, they die, we need to establish what they died from. And I'm very hopeful that such issues are going to be very, very minimized and may possibly not related to the vaccines which will be given. And if someone dies, we really have to investigate what the cause of death is.
Any compensation if it is discovered that such a person has died because of the vaccine?
Kelvin, I wouldn't discuss the compensation. I'm not privy to discuss such information on do we need to compensate. All I can say is I'm very, very hopeful that there will be very few events of severe side effects, and hopeful that possibly we don't even lose anyone because they have gotten the COVID vaccine.
Prof, thank you so much for making an appearance on this special interview, and wishing you all the best as you start with the frontline workers, as you start, administering this vaccine tomorrow.
Thank you so much. I'm so grateful for having me.
This has been a special interview on your channel of choice, Muvi Television, today the 13th of April in the year 2021. My guest on the program has been Professor Lloyd Mulenga, who is Director, Infectious Disease. Many thanks to Professor for making an appearance and respond to the many questions that you people have been sending, as well as the two callers that have managed to call in. I hope and trust that Professor has managed to answer your question. Many thanks also to Mavuto Piri, as well as Cedric Nkonjera Jr., who have been my producers as well as directors of this show. My name is Kelvin Tabola, Chief Focal, wishing all those that will be going to receive their first dose of the vaccination or the vaccine tomorrow, wishing you all the very best. My name is Kelvin Tabola, Chief Focal. Until next time, good night.